I'm Dr. Maryann Prewitt. I'm a gynecologist. I have a clinic that is Health Wellness MD, and it is a very holistic and alternative medicine approach to life. Our mantra at the clinic is look better, feel better, optimize your health. And we try to use a non-medicine approach to life, use as few drugs as possible. Our greatest success at the clinic is taking people off medicines, not putting them on medicines. The core root of the clinic is we guide and help patients take ownership of their own health. That includes commitment to an exercise program, nutrition, and taking valuable supplements and optimizing hormone levels. I've wanted to be a doctor since I was a little girl. I had a congenital heart defect. So at a very early age, probably about 8, I was in and out of the hospital, and also saw my cardiologist monthly. And I just fell in love with the way he cared for me, and I wanted to be a doctor. When I was in medical school, I worked with Dr. Duke Sampson in Houston, Texas, and I absolutely adored him and the trauma. So I originally wanted to be a trauma surgeon. As I went through my training, I felt like I never established a relationship with the patients. It was just fix them, they're broke, send them back out. Then I went through the OB/GYN rotation, and I only sleep 4 hours a night, so it was just a real good fit for me. And I liked the long-term relationship with the patients. I think medicine reflects my life. I'm very passionate about taking care of myself, exercising. I love each relationship that I enter into to bring something to that relationship and to impart some of my learning and knowledge to people. When a patient walks into my office, the most obvious pursuit is their gynecologic exam. However, I educate the patient about the whole body. In my clinic, we have the med spa, where we can address skin issues, body areas, weight loss, contouring, as well as removal of skin cancers, moles. A lot of times women secondary to childbirth have some changes that occur in their private areas, and we can attend to all of those issues as well. When family members see the changes that are occurring in my patients' lives, they're curious and they want the same care, and they want those things happening in their lives. My surgical specialty is using the Vinci robotic surgery. We are able to accomplish surgeries with minimum damage to tissue, minimum blood loss, and also minimum loss of time from work. So it is a very impressive combination. And in addition, in our med spa, we do scarless surgery. So any incisions that are there, we make them go away. I think it is so important that we as physicians do practice medicine at the highest standard at all times. Many physicians go out and practice medicine and they don't practice it any different than they did 20 years ago. There's a lot of technology that occurs. There's a lot of breakthroughs that are occurring. There was actually an article just posted last week that physicians should be managing hormones and optimizing hormones, and what a huge impact it has on longevity and quality of life. The reason it's so important to me to be in Top10MD is the company's sole mission is to find the patient the best physicians possible, not necessarily to celebrate the physician.